Welcome back to my channel. Today we are doing part 2 of low libido. We are talking about treatments that can help women with low libido. If you're new here, I'm Dr. Reena Malik, urologist and pelvic surgeon. We talk about urologic conditions, bladder health, sexual health, and much, much more. So if you like what you see, make sure you subscribe and share this channel with your friends. Just to recap from our last video, low libido is very, very common. It affects about 40% of women, but only 12% of women are really bothered by it. So I talked about all the risk factors for low libido in my last video, and if there are medical conditions that I listed there or medications that you're on, certainly you want to tackle those issues first because fixing those can potentially fix the issues of libido. So let's start with easy things. What are some lifestyle changes that can maybe increase libido? So it sounds pretty straightforward, but things like fatigue and stress are big contributors to low libido. So working on improving those things can be really helpful. And like, how do you really do that? Well, trying to prioritize your sleep, or if you're worried that you might have a sleep disorder, make sure you go talk to your primary care doctor about that. See if you can get help with children. If you have small children at home, trying to get someone to help with them so you're not so tired all the time, which is easier said than done. I know for some people that's not an option and that's not affordable, but certainly even asking a neighbor or a friend for help sometime can be helpful. Also trying to incorporate exercise, yoga, mindfulness, other sorts of meditation, things like that that can reduce stress may be helpful for you. And also, if you are able to get that friend to help or hire a babysitter or have, grandma watch the grandkids, having a date night with your spouse, even once a month, can be really important in trying to rebuild a good relationship with your partner so that you can kind of rebuild that intimacy. Certainly, as I mentioned in my last video, there can be a lot of relationship issues that can contribute to low libido, and communication with your spouse is key. And so in those cases, a lot of times going to a sex therapist or going to couples therapy can be extremely helpful. But what can you really expect during couples therapy? Well, it depends. If you go to a sex therapist, from my understanding, most people will generally work on first educating the couple on what the normal sexual response cycle is, address any specific maybe religious or cultural concerns that you may have about having sex. What is a normal expected frequency for you as a couple to have intercourse? And maybe even including some specific exercises and offering resources like books, visual aids, devices like vaginal dilators, and specifically focusing on mutual sexual pleasure, which if you missed my video with Lisa Mangladas, we talk about that a lot in the sense that a lot of times women don't even really focus on their pleasure when they're so focused on their partner's pleasure, and that at least 85% of women do need clitoral stimulation to achieve orgasm. And so making sure that your partner is aware of that and incorporates your pleasure into the relationship and into intimacy time can be very, very valuable for low libido. So another type of therapy that's offered is called sensate therapy, and this is essentially a therapy that's focused on touching, and it starts with touching non-genital areas, and you slowly kind of advance to touching in more erogenous areas. But essentially it's meant to reduce anxiety and reduce the avoidance of sexual intimacy and also improve intimacy, and particularly for women who have concerns about pain with penetration, this can be really helpful. Also, you can engage in cognitive behavioral therapy, which really focus on the thoughts and behaviors that kind of come in the way when you're about to have intimacy or sexual relationships with your partner, to really focus on what if those thoughts and behaviors are kind of automatic or maybe getting in the way of proceeding with sexual intimacy. But if you've tried all these things and your relationship's great and you're super healthy and there's nothing else going on that might be causing this low libido, there are 2 FDA-approved medications for low libido in women. The first one is called Fulbanserin, or brand name is Addyi. It's a medication that's taken once a day at bedtime, and what it does is it works on serotonin receptors to essentially increase the brain dopamine. So like I talked about in my last video, dopamine is a key neurotransmitter or chemical messenger that causes sexual excitation. And so it's taken once a day at nighttime because it does cause some drowsiness. It's specifically only approved for women who are premenopausal, meaning they have not yet gone through menopause. You need to give it a good 8-week trial to see if it works, and there are some side effects to be aware of, specifically being very sleepy. That's why you take it at night. And there are low risks of getting low blood pressure, dizziness, fatigue, or nausea, which were commonly seen in the studies. However, in the studies, only 13% of people actually stopped the medication due to side effects. You do need to be careful taking this with alcohol, because both of those together can make the drowsiness much more significant, and so it's not recommended to take it with alcohol at the same time. Certainly you need to delay for a certain amount of time after having 1 or 2 drinks, or if you have 3 or more, you shouldn't take your dose that night. In the studies, they found that libido increased about 54 to 58% for all women who were on this medication. So certainly not a home run, but certainly can help many, many women who are suffering from low libido, specifically if you're premenopausal. Another medication that's available for those who are premenopausal is called bremelanotide. Bremelanotide is an injection that you give yourself before you want to have intercourse. You need to give it to yourself about 45 minutes before you want to have intercourse or engage in sexual activity of some kind. And in the studies, it actually showed improvement in sexual satisfaction and desire in about 51 to 57% of participants. It shouldn't be used if you have uncontrolled high blood pressure or if you have cardiovascular disease. And the most common side effect is nausea with the injection. But the nice part about it is you just take it before you want to use it. You also do need to be on some sort of contraceptive or using some sort of protection if you're using this medication, because it can cause unwanted side effects or harm to a developing fetus. So there are also some off-label treatment options, which I'm going to touch on briefly. And if you want to learn more about them, please comment below. One is using topical testosterone for women who are postmenopausal. So like the other 2 medications were for premenopausal women, this is for postmenopausal women. Another couple of medications that have been shown off-label to help are bupropion, which is an antidepressant, and buspirone, an anti-anxiety medication. And so those are all used off-label for the use of low libido in women. If you have tried other things, have a normal, healthy relationship, and no other issues that need to be addressed. I hope this is helpful to you. Please comment below. Let me know if you liked it and what more you want to learn about. As always, remember to take care of yourself, because you're worth it.